There you go. This is, once the patient is set up on the ventilator, the ventilator obviously will be running. You have two sets of separate suction that have to be set up. You have one for inline, and you can take the oral suction off of here and go ahead, making sure that you have suction here, and then I want to leave it on regular and turn my pressure down. 150 is the absolute max that you go to, so you have to occlude it in order to check. And right now it's saying 180, so I still got to turn it down. And I'll let it go again and then just bring it back up because it's very sensitive. 80 to 120 is your range, but if you've got to go to 150, you're okay. So it's 150, and then I hook this up here. Then I also have to have one, if you have a ET tube that is a subglottic suction ET tube, not all of them are, but this one is a CASS tube, continuous airway subglottic suctioning, CASS. And a lot of places use these. You can choose whichever, if you put it on continuous or intermittent. If you put it on continuous, it needs to be set at 20 to 40. If it's on intermittent, it needs to be 120 to 140. So, so you have a choice here. This regulator only gives me continuous or off. So I'm gonna have to leave it on continuous, which means then that I have to turn my suction down to -20 to -40. And then I occlude it, and when you occlude it, it's still raising, so that's why you have to occlude, check your equipment. And it keep on going down. Okay, so I'm smack dab right in the middle, and it has its own suction canister, and then I hook it to the CASS tube. And I do like to take a little piece because you don't want to fish hook your patients. Piece of tape, tab it on both ends, and you can secure this to your ET tube. Most likely your patient will either have an NG or an OG tube, and your nurse will also use your ET tube to secure their NG tube. Okay, so that's how you set it. There you go.
All right. And how do you know if you have a CASS? You have more than just a cuff.
Yeah, you have more.
Pilot balloon. If you have an extra tube, you can set up the suctioning.
But the key is that they have to be separate. According to the CDC, your oral, your inline, and your CASS tube have to all have a separate suction canister, which is really kind of crazy in an ICU setting because you have so many, you don't have that many regulators either.
And that's not even counting chest tubes or wound vacs or...
Right, but they say that for infection control, not to cross-contaminate as well.